Well, kids' mental health is in crisis across the U.S., according to the experts at the American Psychological Association. But there is a gap in the kids who need help and the ones who are actually receiving it.
That's right. A study by the University of Michigan Medical School shows that less than half of kids actually get any kind of treatment for their mental health. And one reason is because some parents simply don't know how to tell if help is actually needed. So author, speaker, and psychologist Dr. Eileen Kennedy Moore is here to help us answer that. Dr. Kennedy Moore, thank you so much for joining us.
My pleasure. This is such an important topic. And I think a lot of times parents don't seek help because they think, oh, it's not that bad. But if it's not that bad, a little bit of help could make a big difference.
Yeah.
If a child is having symptoms and they're getting worse rather than better, and they're lasting a while, go find a mental health professional because it really can make a huge difference.
I love that. And, you know, when you're talking to kids, you call yourself Dr. Friend-tastic. Why is that naming convention even important?
Well, I don't do that so much in my practice, but I have a podcast called Kids Ask Dr. Friend-tastic. And I started this because I was seeing so many kids who are just struggling with friendships and the ordinary conflicts and bumps and bruises of getting along with people. So it's 5 minutes, comes out every week, and each episode features an audio recording of a question from a child about friendship. And then I try to say something practical and thought-provoking.
Oh, I love that. Going back to the kids' mental health aspect of this, sometimes kids are whiny, sometimes they're anxious, sometimes they're having a bad day. What tells you that it is something deeper that you might want to explore with a professional?
If it's continuing, if it's interfering with the child's functioning or interfering with the family. I see a lot of families where everybody's on eggshells, hoping that we're not going to set off the kid. And that's a sign that that child really needs help. We always want to reach first for empathy when we're talking to a child. And we can never go wrong by just acknowledging their feelings. You're worried that a bad guy is going to come in at night. But we don't want to just stop there. We also have to help the child develop coping strategies or new ways of thinking about the situation. Children's fears tend to grow along with their imagination. So sometimes it helps to ask, if they're afraid of the bad guy, how many times in the last year has a bad guy come into your bedroom? You know, not so often. Do you know anybody personally who's had that happen? No. And that helps them to get more of a scale of what is likely. And then we wanted to give them a plan. So, for instance, if they're afraid of something imaginary, who's in charge of their imagination? They are. Blink your eyes and change the story, maybe to something funny. So if it's a monster, what if you pull out the plug on the monster and all the air blows out and it just ends up in a lump on your floor? That's not real, but neither is the monster. And we can laugh about it together. Laughter is incompatible with anxiety.
I love that. I also love the example you gave because a lot of times you're dealing with anticipatory anxiety, right?
Exactly.
Kids are imagining something that has not come to pass and they're already feeling pent up and anxious. What can we as parents do to sort of minimize and reset ourselves so that we're giving that sort of good, calm energy to our kids?
Exactly. So the formula is empathy plus confidence. So we want to acknowledge this is scary for you, going to the birthday party. You don't know that many kids at the thing. But we also have to express confidence that our kids are going to be able to handle this, even though they're scared. Avoidance makes anxiety grow.
Right.
So we want to, especially when our kids are doubting themselves, we need to be really behind them. You can do this. And maybe we'll give them a game plan. So with the birthday party, you might say, okay, so here's what you're going to do. When you get there, you look for the pile of the presents, then you look for the kid and you say happy birthday.
So you're
and
telling them what to expect.
Exactly.
This is great. What's the name of the podcast again?
Kids Ask Dr. Friend-tastic.
Perfect. Author, speaker, and psychologist Dr. Eileen Kennedy Moore. Thank you so much.
My pleasure.
And stay with us. You're watching NBC News Daily. That was